Hi everyone, in this video we will discuss about the diabetic ketoacidosis treatment. So what is the mnemonic for it? So first of all you have to remember the mnemonic King UFC. So what does it means by King UFC? So diabetic ketoacidosis is a very severe condition, so you have to manage by first of all K for the potassium, so we can give the patient potassium. Next one is I, we can give the insulin to the patient of diabetic ketoacidosis. The third one is N, if the patient is the comatose, then we can insert the nasogastric tube. Then another one is G, we can give the glucose once the serum level drop. The next one is U, we can monitor the urea of the patient. The next one is F, we can give the crystalloids like normal saline or the dextrose saline, the fluids to the patient. Next one is C, we can monitor the creatinine, and we can also catheterize the patient if the patient is comatose. So we can manage the diabetic ketoacidosis by these these things. So I hope you have liked this video. If you have liked this video, please share it to your friends, and if you have any question you can comment below, and if you have not subscribed our channel, subscribe it, and thanks for watching.